Hey guys, we're here. We're live. We've already got a bunch of questions. We got our fabulous team here. Sarah, we've made it easy for you guys. Not a lot of names to remember. But if you don't mind, we'll jump right into some questions. You want to read the first questions, Sarah? One of the Sarahs?
Yeah, so let's see. First question, you started with the under eye filler. For the under eyes, what type of recovery afterwards?
Ooh, that's a good one. With any of our fillers, I always tell people got to be a little bit careful. Bruising is the one thing that you might get. I'll tell you, under eyes, I used to guarantee people that they were going to get bruising. Since we've switched to cannulas, I have not seen that to be the case. I still tell everybody, if you got an important event on that Friday, Saturday, don't come in on Friday for under eye filler for a big event Saturday. But other than that, a little bit of bruising, people come in their lunch hour, they can go back to work that day, you can go to dinner, you can get back into your regular life. So the recovery is actually pretty quick other than that.
Yeah. And then the next question was any bruising after under eye filler, which I think you already kind of chatted. Mm-hmm. And then the next question that everyone wants to know is how long does the under eye filler last?
Just before I forget, I love arnica. Arnica pills, if you are a bruiser, started them ahead of time. A little arnica cream, if you do get a bruise, I think helps you get out a lot faster and starting that right away. Yeah. Just a little insider tip.
100%. Arnica is great.
Was the question, how long does it last?
Yeah.
Ooh, that's really a great one because it used to be in the under eyes because of how thin the skin is. We had to use certain products that were very, very thin, which is great, but they tended to leave a little bit faster. The nice thing about the new RHA product is that there's a different spectrums in terms of how thick the products are, and so we can use something a little bit softer and still last for about 15 months. So and the under eyes, I wouldn't be surprised if you even see it much longer because there's not a lot of motion there. So definitely going to be a long time.
Right.
So, okay, next question. Is it buildable on top of Restylane Kiss on lips? You want to take that as our
cream? Yeah. And the other question was how long does RHA filler last? So I think I'll kind of do the two together. So to Dr. Franco's point, the filler lasts up to 15 months. The lips tend to be slightly less than other areas only because we're eating, drinking, talking, and all of those things. But the goal for you would be 15 months. Everyone's a little different. And then is it buildable on top of Restylane Kiss? Yes. Essentially, Restylane Kiss is still an HA. It's still a hyaluronic acid. It works very well. One great thing about RHA, especially on top of other fillers or individually, is that it has really good tissue integration. So it moves and it animates really, really nicely.
And one of the things that I think that's super important is, remember a couple of things. When we say 15 months, people think it's like a light switch that you turn it on, you turn it off. Most of the studies just say that people still have some, appreciable filler at that amount of time. So it's not like you're going to have filler and then all of a sudden one day you're going to wake up and be like, oh, it's all gone. It doesn't really work like that. We wake up one day and we look in the mirror, somebody said something and we're like, oh, shoot, I need filler again. But it doesn't just magically disappear at a certain date. And no question, the more motion, the faster it's going to go. I think she brought up a good point, and you were actually talking about this earlier about when we were talking about something else in terms of layering. I do like using some of the products in terms of with some of the new motion technology, you can get a little bit more superficial than we did with some of the maybe first generation filler stuff.
Right, absolutely. I think it's worked really, really well. And, to your point, I just think another good thing to touch on with you guys is when asking about like longevity and stuff. Once you're hitting like that 6-9 month mark and you feel like your filler is starting to go down either in the under eyes and the cheeks and the lips, come back in and see us. We're happy to do a full facial consult on you. Maybe we add, a half of a syringe or a quarter of a syringe or whatever to just keep you at the volume that you like. And I think that's just a really good point that some people think they have to, like you said, wait till that 15 months to come back in and touch that filler up. So.
Sarah, when you did Jenna's cheeks, did you do this more superficial or did you do deep and superficial? Because it's a big trend and I feel like that's changed a little bit. And she looks fabulous and she's in her 20s, 30s. I can't give away her secrets,
20s.
But
early 20s.
What did you do? Because she looked good.
Thank you. For Jenna, I did actually mostly deep. But with the RHA, I've been loving being able to do the combination. For her, she's literally never had any cheek filler. So we were focusing a little more on structure, correcting some deficits. So we always, I would say most of the time, we want to put a little bit deep to create a little bit of structure. But what's great about it is we can come back, use the cannula, create some blending, create like a filter on the face. So I really love, that's what I did today as a combo of the both. both with RHA 4.
Mhm.
So putting a little bit deep, and then I came back with the cannula. I blended it. I was able to create a really beautiful contour and just a nice filter.
One of the cool things, and we were talking about this because we were at a training course because we're always trying to learn, and you guys are going to another training course because
Yes.
I feel like they're surpassing me. They're going to be teaching me. I'm going to be calling them for help. But it's, you know, the product, most of the original products, if you look at the old stuff, people used to talk about pillars and so forth, which I think are still super important. We still do it. But now there's this whole motion idea that, you know, making people restore their volume, but still be very dynamic because, you know, we can all look great when we're like this. But, you know, we don't want to do that most of the time. And so we want to be more animated and moving. It just flows with us. And that's what you're talking about.
Yes. And what did we see today that we loved? It's beautiful at rest, but flawless in motion.
Yes, which is one
Right.
of their like kind of campaign lines for
Yes.
RHA, which I think perfectly describes it. And like you've noticed, and I've noticed with cheeks, is being able to layer that filler
Mhm.
a little goes a long way. So you will get like the biggest bang for your buck for the syringe just because we can really do a whole lot with it. I think it's great.
Absolutely. Maybe like put a little back in your cheekbone, but if you really want to focus on your nasolabial folds, if you've already had cheek filler in the past, we can turn it around, put a little bit here. Like you said, like I do say typically we need about 2 syringes for cheeks, but sometimes if you've already had some structure, we can use 1,
Yeah.
do some correcting, do some smoothing.
It's really good for target areas. I think we can really just do more with just deep layers and that's the end of it. So I think it's great.
Somebody asked what's the difference between RH2, 3, and 4.
Yeah.
Do you want to maybe walk them through the 3 really quick? I feel like we've touched on it a little bit, but maybe synced it in a little bit.
Yeah, so RHA2 is going to be the filler that we're going to choose for tear troughs and then a really gentle lip. So somebody that just wants some hydration, just wants a little bit of structure, but nothing really big and pouty, just adds a little bit of volume and looks really great.
Mhm.
And this isn't dead set on anything, but this is kind of what we're recommending at this point. RHA3 is going to be great for mid-face, lips, jawline, chin, all of those areas. RHA4 is a little bit stronger of a filler, so we'll most likely recommend that for cheeks and jaw specifically. But all in all, the great thing about this filler is it can be injected on the different layers, and so we can use a lot of the fillers 2 through 4 in all different areas.
And that's where your provider will walk you through, because the bigger the number, the thicker, stronger the product. You know, like Sarah said, these are gross generalizations, but just depends. Sometimes people need a little touch here. Sometimes you're worried about it. The next question to kind of roll into that is about different types of skin types, you know, and whether these products are great. I think the products still work really great on any type of skin, but you do have to be a little bit more careful where you're placing it, how you're placing it, depending on how thin people are, not just their skin, but how much fat pads they have, kind of their bony structures, because you can sometimes over masculinize, over square people, do stuff depending if they're really thin. So I think that's an important part, and that goes into that kind of whole evaluation that the Sarahs were talking about of what fits you. So, and that's the cool thing about the different ranges is you can tweak that depending on your specific skin type, bony structure, fat deposition.
Yeah. Let's see, what do we have next? Someone said, great job, love learning from you all. Thank you.
Yay.
Yeah. So do these fillers work well on ethnic skin? Same kind of question that you just answered. They're great for everybody. They are wonderful. If you look at a lot of the before and afters, a lot of the marketing through the RHA, it shows you a diverse
Wide
group
range
of patients, ages and ethnicities all across the board, and it's really amazing. What is the different costs between RHA 2 through 4? Answer?
Yeah, we actually charge the same for all 3 of the different levels, 2, 3, or 4. Our price here at our practice is $800 a syringe. We are going to offer y'all an exclusive discount just for being here tonight. Are we going to give away the code yet?
Oh yeah, might as well. Because who wants to say it? People want to say it all the time.
That's right.
But don't share it with anybody. Just for you guys.
This is just for you that tuned in today. We have a special offer. You want to tell them what our code
Oh,
is?
secret code. Shh. Sarah Squared.
So $100 off any of the RHA syringes. If you mention Sarah Squared, you do need to come in October.
But you gotta say it in the low voice like that. Sarah Squared.
Actually, we won't make you do that. But we do have an in-person RHA event coming up that I know y'all will see about on our social media. And for those that are coming to that, have to come on that day. But for all of you for tuning in tonight, you get the discount just for tuning in. So anytime during October. So give us a call. Y'all know our phone number, but 512-334-9917.
9917.
Just mention Sarah Squared and we will give you the discount. Absolutely. So super exciting about that. I think also we're going to give away a couple coffee cups. some exclusive swag, some Austin Plastic Surgeon hats. I think we have like 5 swag pieces to give away tonight. So we're going to get a list of all of y'all that attend, and we will make sure and reach out. And we're going to answer a few more questions, but I just wanted to make sure we touched on that. So $800 a syringe, you're going to save $700. That would be nice, but $100 off each syringe, which will make it $700. Just mention Sarah Squared.
Perfect. Someone said downtime again, so in general with filler, we ask that you wait 2 weeks just for everything to settle. And what I do think, another point that I'd love to touch on if we're talking RHA, is I did cheeks a few weeks ago on someone, and I saw her 3 weeks later in office, and she actually called me out and said, hey, I need you to come see your great work. Her filler looked twice as good 3 weeks later. Yeah. It settled, it integrated, it moved naturally. She looked amazing. So this product is really, really good for that. But we ask that you give it a full 2 weeks for swelling, bruising, and all that stuff.
And that's such a good point. Like if you're planning an event, if you're going to a wedding, if you're going to something, I can't say this enough. And then don't tell us, hey, you never bruised me. You have just jinxed yourself. Don't say that. Don't come on a Friday and say, Sarah, you've never jinxed me, because you've just sabotaged yourself. Like plan ahead, because you don't want to put that pressure on yourself or us.
Right. And start the arnica. If you're extra smart, start the arnica early. Expect it. We're obviously going to minimize it as much as we can, but expect some swelling. Yeah. Scroll down a little bit.
Perfect. Let's see what other questions we have here. Go all the way down. I think we missed one.
Great job. Love learning from y'all.
Why are y'all so awesome, making everyone's dream come true? You make our dreams come true.
Thank you, Melanie.
We can only do what we do because of all of you, and we appreciate it. Thank you. A couple of people are asking about different types of filler, and I think we can get into the weeds of too much of this. I would say there's a couple broad categories, because we could go through every product and be here for the rest of the night. So
y'all don't want that.
There's a couple. Two big distinct in terms of the HA fillers, which is the hyaluronic acid, which is a little bit softer, more pliable. There's the originals that were made to be a little bit stiffer, a little bit more for rigidity, which definitely still has its place. Some of this newer generation is more motion, expression, is to flow with the face, and that's what this RHA2 is about. And so during the consultation, we're happy to discuss the different products, but maybe we'll do some more lunch and learns about kind of what's in each category, but that's kind of a big generalization, because if not, we could go endlessly about that.
Yeah.
This is a great question. I think, how many syringes are normally used for lips or cheeks? Lips, I would say 1 or less in one session, right?
I never inject more than 1 syringe per sitting at all. I think lips have to be done in detail. I don't think that there's a benefit to just blowing a ton of filler in there. I think doing it slow and steady gets people the best result. They have a lot of detail. We can get you to a certain size, but it may take a couple sessions.
There's this whole concept of lip stretching, and I think you're not trying to eat up all of our time here, but I think it's super important, because people come in with these huge luscious lips, and there's this concept of stretching, and even in the butt surgeries we do and other stuff, there's a limit to what you can do in one place, or else it just becomes very hard to get malplaced product that starts to migrate. You have a very weird frozen look stuff. It doesn't get you that luscious look that you're going for. You're better off doing it, coming back a couple weeks later. We're not going anywhere. Your result's going to be so much better. I mean, and if we didn't care about you and your result, we'd be like, sure, pay us a bunch of money, we'll pump a bunch of stuff in there and just do it. But it's not what's going to help get you to the right spot. So good point you pointed out.
Yeah, we want you looking amazing. We want you loving your lips long term. We don't just want to blow a bunch of product in there and then we're dissolving them a couple months later. So slow and steady is the move for lips. You want to talk about cheeks?
Yeah, I was going to say you got to be patient. I was going to say you and I would be a good example. So I have 1 in each, right? And you have 3. A couple, 3. So there's a whole range with cheeks. I would say if we're talking budget, we could make a difference sometimes with 1. If we're going to use cannula, work superficially. It totally depends on your face.
That's super rare. You're talking young, healthy, very specific person, because you need more product than you think. Most people are so afraid of this overfilled look. That didn't happen by accident. I promise, didn't happen with 1 syringe.
That's right. So look, Sarah has 3. She looks beautiful. I have 1 on each side. So there is a huge range. It's totally going to depend on your anatomy, the thickness of your skin, how much fatty tissue you have, what look you're going for. Bring in wish photos.
We love wish photos.
So I would say average, we really like to start with 2 in the cheeks, 1 on each side. Like if I could pick, I would like to start you with 1 on each side. Sometimes we need more, especially if we're going to do like a liquid facelift, treat the jawline at the same time, treat the chin. Those are some areas that we really like to do at the same time. So It definitely depends on the patient. Average, start with 2. Sometimes we need more.
I would say the vast majority of people start with at least two syringes for
And
sure.
probably end up like in the 4 to 6 range over the course of a year, I would say.
Because and the thing that we try and fight, because sometimes people can be like, I just want to do 1 syringe, but I want to do my cheeks, I want to do my lips, I want to do my chin, I want to do my jaw. And the problem is you don't see a difference anywhere. Now you feel like you've spent money and you don't see anything.
Because
So
we're talking 1 mil.
yeah.
1 milliliter.
Yeah.
It's
tiny.
syringe. Think about 1,000 milliliter thing of soda. 1 milliliter. You know,
Right.
It's like a little baby drop.
right.
Yeah.
Right.
Yeah. So at least 1, if not up to 2 and 3. And that's where her and I have chatted. Dr. Franco's in on this. We love coming up with like a 1-year plan for you. So when you come to the office, we'll do a full consultation from top to bottom. You know, what are your goals? What areas do you not like? What do we see? And we can come up with a plan of, hey, let's start with cheeks. We can come back and do under eye. Nothing has to be done in a day.
And sometimes it's just talking through that of what bothers you, because sometimes, you know, you may have something that bothers you, but what's causing it may be different than what you think, and we can help. And it's funny because sometimes people will say stuff to us, and you know, I know it's an RHA event, but sometimes maybe it's a little toxin, maybe it's a little skincare, maybe it's something like, it may not even be what you think it is.
Yeah.
And sometimes it's something super easy. There's sometimes people come in for something, I'm like, oh, you need just like 5 units of toxin and that'll fix that little spot that you're worried about.
Yeah.
Sometimes it's that people come in and they're like, oh, I need this. And it's like, you know, we really need to start building a foundation, and we're going to fill that so that it looks natural. And sometimes it's a weird work backwards to look natural. You actually got to start from the foundation and build up, because if you don't have a good foundation, you can do some cheater stuff, but it's never going to look right. And then you're going to always be chasing your tail.
Okay,
Absolutely. Let's see what else.
We have all the info already here for you guys. Let's see what else you got. Can it be used in the 11s?
That's a hard one. Can it be used? Sure. The problem becomes this: if you're getting this line here because you get a ton of motion, if you don't stop the motion, you're going to eat through that product really, really fast.
That's a good
You're
point.
not going to get the result you want. You're going to feel like you spent a lot of money, and 2 or 3 months it's gone.
Yep.
And be like, yeah, it is. And so, you know, it's typically a combination therapy. Usually, because remember, you get those lines here from the motion because you're folding the piece of paper, right? As long as you're folding that piece of paper, that line's never going to go away. So you got to stop the cause to begin with. And then there is times that we'll come back and fill it, but I typically won't do that till we've stopped the problem, what's causing that, because then it's going to get better.
Before we answer any more questions, I want to make sure we talk about our giveaway that we're doing.
Ooh.
So because we didn't mention this, we talked about our exclusive discount, but we are also going to be giving.
We were holding out.
I know, and I didn't want to
For all of you that are before you
make sure after this they are going to ask you if you're interested in a consultation. Make sure you text yes, because that is going to enter you. Of course, we hope you are interested in a consultation, but
Why wouldn't you want to come see us? We're fun. We are fun. My mom will call each of you and tell you that we're fun.
Yes, that's true.
She will.
Okay, but we are going to sign.
I'm just kidding. She will not respond to your text. My mom will not respond to your text. I promise.
Unless it's Winston, she'll respond. You can find a way to make
sign you
Winston
up for a
text
free phone list. But we are going to be giving away. We talked about swag, but we're also going to give away a free syringe of RHA. So
Yes.
super exciting.
to one of you lucky viewers.
So we're going to get the list of y'all that respond yes after this, and the list of everyone that attended. So make sure you text back yes, and then we will announce tomorrow. I think.
Yeah, let's do it tomorrow.
Let's do it.
Swag
We can't
it.
keep them in suspense forever.
That's right. So find us on social media at austintplasticsurgeon to find out the answer. But we're going to be giving away a syringe of RHA as well as several swag giveaways. And then y'all already know about your exclusive discount. Don't forget the code.
Sarah Square.
That's
Okay.
right. For $100
But remember, you gotta say
off.
it.
You know, $100
We're gonna be getting
off.
all kinds of phone calls, and all the girls.
No,
in the front are gonna
poor
be
Jen and Emily gonna be like, people keep whispering in the phone. I can't hear them.
What? Anytime during the month of October. So if we're talking liquid facelift, we're talking $100 off a syringe, right?
Mhm.
So let's say 2 in the cheeks, 2 in the jaw, 1 in the chin, 1 in the lips. That's a huge discount.
Huge
Huge
discount.
You're welcome.
Huge.
Yes.
You're
We're
welcome.
getting you guys together for all your holiday parties.
Yeah.
Yes.
Okay, let's
Holidays
see. What
are
other
coming up.
questions? I want to get all your questions. So
Yeah, because we're home stretch here.
Yeah,
Yes.
I think
Y'all answered all our questions. Thank you.
I wouldn't trust my face with anybody else.
Y'all are
This
the
type of filler.
sweetest.
Thank you.
Yay.
Very much answer all the questions. What type of filler? Wait.
does the type of filler affect the shape it gives you?
That's a
Yes.
good question.
Yeah, because that's like RHA 4 is going to be more structure, more strength, which means you're going to get more projection is a good way to say it, right?
Compared
More
to an RHA 2,
contour.
which is a lot softer.
Or even in lips is a good way to think about it, right?
Mhm.
If we're just talking a hydration treatment, which we were just saying the other day.
Yeah, RHA 2 is great. If we
It's
want
great.
something thicker, RHA 3 or even 4, depending on what you're going for.
But I think it's everything, right? It's the product, it's the placement,
Mhm.
it's the technique. I think
Absolutely.
all of those things play a huge role in the structure. The amount.
Mhm.
So I think there's so many variables, and that's why I think just you can't just. We talked about syringes, but it's more than just a syringe of filler because it's understanding what you're trying to get. This is what we're talking about when we say a lot of these are general statements because there's so many different things you can do. And these are the cool little nuggets that you just learn as you go and seeing stuff and hearing people. And I'll share one of my secret nuggets is when I sit down and I'll sit down in front of you and I'll usually tell you about my little Wednesday or something. I just want to see you talk because when you're trying to show me or tell me what bothers you, you won't be able to do it on command. When you're thinking about something completely different, you start doing it and then I can see it when you're not thinking about it.
Mhm.
Still a
Yeah,
nugget for you
absolutely.
guys.
And our goal is just to make you look like a more beautiful version of you or a younger version of you. We don't want to make you look different, you know? So you come to us, tell us what bothers you. We can recommend what we think would be great, right? But we were talking about that today earlier. Like, we're not trying to make you look different where somebody's like, who is that?
Yeah,
You know,
yeah.
just like smoother, younger,
Refreshed.
refreshed is a great way to put it. Absolutely.
And the recommendation Sarah might make for if the other Sarah came in versus if I came in would be very different. And they may be some of the same products, but not maybe the same placement, the same
Right.
amount, the same, type of technique for it.
Yeah.
Essentially injecting, if you're really passionate about it and good at what you do, I believe everybody considers it an art, right? You hear that all the time.
Absolutely.
There's different eyes for everything.
Make sure we don't miss anything else.
What is the approximate cost for a liquid facelift? I think that's a good question.
Yeah.
Kind of touching on what you just said. It depends. It's different for everybody. I mean, if we're considering cheeks, jawline, and chin, that could be 5 syringes. But depends on how many deficits you have, what your tissue looks like, what your skin looks like, what goal you're looking to achieve. Some people, it might be double that if they want a lot of volume. Sometimes they just want a little bit of correction, but it totally depends. But to your point, at least 1 syringe per side in the cheeks and 1 in the jaw, or you're not going to see that big of a difference.
And again, everyone may not have $4,000 to spend right away. So we can always talk about a plan for the year. We're going to start here. We're almost always going to start from the top. I would say we agree with that. We're going to always try to lift. And then over time, when you're ready, we're going to add more here. We're going to sharpen up this jawline. We're going to plump up the lips. So if that's what you want.
Yeah, and we explain all of that in your consults. Okay, let's see. We're getting ready to wrap up. Just listen to you all talk about how much you truly care makes you feel at home. Oh, thank you. We love what we do.
We love the comments. So
Yes.
please DM
We
us, drop us
appreciate y'all.
things. We appreciate it.
Seriously.
Even just hearts, thank yous, no poo emojis.
We love y'all.
Okay, I think we're going to wrap up. That is majority, if not all, of the questions. Thank you guys for tuning in. Thank you for interacting with us.
Yes.
And we want to remind you, like Sarah said, to reply yes to the text at the very end to be eligible for the free syringe, and we will let y'all know who that is tomorrow.
Yes.
And then swag giveaways,
That's right.
discount, and spending time with us. And if you guys don't follow us on @AustinPlasticSurgeon or AustinPlasticSurgeon Med Spa,
That's right.
please do, because the little video clips we show here, we do them all the time,
All
and
the
it's
time.
really nice to see. We really try to do a good job explaining our thought process, how we go about this. We'll keep doing it. I feel like you guys enjoy it, and it gives a little insight of what we're thinking.
Yeah, tons of before and afters. We try to keep it fun.
Yeah.
Thank you
Thank you guys.
Thank
Appreciate
you
it.
guys so much.
We'll see you guys
Bye.
soon.
Have a good
We'll see you
night.
guys on the 14th.
Okay.
Bye.